welcome everyone to our webinar, our New Israel Fund Australia webinar with the Executive Director of Physicians for Human Rights in Israel, Ron Goldstein. Tonight we'll be discussing healthcare, human rights and Israeli democracy during COVID-19. My name's Liam Gatroy. I'm the Executive Director of the New Israel Fund in Australia, and I want to start by acknowledging the traditional owners of the land where I am here in Sydney, the Gadigal people of the Eora Nation, and paying my respect to the elders past, present and emerging. The COVID-19 pandemic is obviously sweeping the globe, and it's having a big impact. Lots of consequences, not just on health and well-being, but also on the economy, on people's families, and of course also on human and civil rights. And that ranges the full gamut of issues, and including maybe the emergence or maybe just even the spotlighting of some of the existing gaps in our social welfare system, a realization that some things like maybe the environment as well as global health crises don't respect national borders, don't respect green lines. And so we'll also be talking about the wider civil rights implications around what governments can and can't do in a crisis like this. In Israel, of course, you add on the layers of a 50-plus-year occupation, of a security apparatus and how those tools are being redeployed from a security perspective to a health perspective during the COVID-19 crisis. In Israel, an unstable and even just recently formed government. These are all the questions that we're going to be talking about tonight. So we're very privileged to have Ron with us. Run's been with Physicians for Human Rights for more than 5 years now. Before that, he was the spokesperson for the International Committee of the Red Cross in Israel. He's also worked with a number of other wonderful organizations, many of which are NIF grantees like Yesh Din and Breaking the Silence and BIMCOM. Before we dive in and we start talking a little bit about Physicians for Human Rights' work, if you haven't joined a Zoom call before, you can click the Q&A button at the bottom of your screen and ask your question. We'll try to get to as many as we can. If you're joining on Facebook as well, you can write your question in the comments box, and we'll also, that will pop up for us, and we'll see how many we can get to. Just again, to welcome everyone, if you've joined a little bit late, my name's Liam Gatroy. I'm the Executive Director of the New Israel Fund in Australia. We're joined at tonight's event by Ron Goldstein, the Executive Director of Physicians for Human Rights in Israel. We're talking healthcare, human rights, and democracy during COVID. So Ron, after that long introduction, I'll pass it on to you, and I hope that you can start by giving us a little bit of an introduction to what you do, what Physicians for Human Rights does in normal times, maybe, and from there we can pivot to talking about COVID, so we can get a bit of this. Hopefully, we'll provide a little bit of context as to what PHR does.
Yeah. So thank you very much, Liam. Thank you, Sharon, and thank you everyone for joining. And we really appreciate also the long stand and the support from NIF Australia. It's something that is really important for us, and we appreciate all the partnership we have with NIF in general, but particularly with NIF Australia for your support. So Physicians for Human Rights Israel combine two main things. We do humanitarian aid. We give humanitarian aid in the occupied territories and inside Israel for anyone who doesn't have regular access to healthcare. But we combine it with policy change work. So it's not just to work that people, for example, in some village will have the medications or the treatment they need, but also to fight for the policy to change. So it's, as we say sometimes, it's not only to open the door in the checkpoints, but to work that there will be no checkpoint in the end. So that's what we do regularly. We have two clinics. One is the mobile clinics. Mobile clinic, we go to the West Bank and also to Gaza. And we have an open clinic in Jaffa for anyone who is statusless in Israel. It means that it doesn't have the Israeli public health insurance, and they need to come to us to get treatment. As well, we have a project on prisoners. So we in contact with the prison service authorities. We receive calls from the prison. We work on freedom of movement for people. So if it's from Gaza or the West Bank, people need to go out to get treatment, or medical team who needs to go out and get treatment. But I can say in general, like our main focus is to talk with the Israeli public, to talk with the medical community in Israel, and to try and do the change from within, because we believe that the fact that I'm not a doctor, but the fact that a lot of our work is done by volunteers, by the medical community. So we believe we have the power or the strength to speak with them And many times when our volunteers are the one who carry the message, it's very strong. So we do a lot of education work, medical ethics issues, and also work regarding the public health inside Israel, working to close the gaps between periphery and center, and many, many other things. So what happened, let's say, during the corona, when the corona crisis started, we had to adjust all our work to corona mode, let's say. Our mobile clinic cannot go now to the West Bank and Gaza. There is a closure which is done by the PA and Hamas. So we were not allowed to go with the big groups of doctors and enter villages or go to Gaza, to the hospitals. However, we continue and we provide medication. So we have the mobile clinic transferred to a pharmacy clinic. And we go to villages. We are the only one who actually go from within Israel, except of the settlers, of course, but to go from within Israel to the West Bank, to Palestinian village, and go and provide medications, because for many Palestinians to cross from Nablus to Ramallah these days, it's impossible. So obviously for people who live in area C and area B, it's much more difficult. So, and there is even before the crisis, there is an economical crisis in the West Bank and also in Gaza. So the fact that we continue and provide medications and medical equipment to Gaza, it's something that is really appreciated in the Palestinian side. We continue to do consultations, doctors who can do consultations from distance. Based on our good connections in Gaza, so doctors in Gaza contact the partners in the Israeli side. Our volunteers who usually go to Gaza, and now they speak with them on specific cases or more general on corona issues. But I think that the general adjustment we have to understand to do in Physicians for Human Rights is to see how all the populations that we deal with on regular time protected to corona time. So asylum seekers, prisoners, Palestinian occupied territories, and also, in Israeli periphery, if it's more elderly people or Palestinian citizens of Israel who needs translation and things like that. So every aspect that we can tackle, we did it, through our regular work, but we had to adjust to corona.
So I want to zoom in particular on two of the different issues and two of your different focus areas tonight. Like I said, one will be, I think, focusing really on people seeking asylum and refugees, and also on Palestinians, both in the West Bank and Gaza. We've spoken a little bit previously about Australia's treatment of people seeking asylum here, and so that's of particular interest to a number of our donors and supporters as well. Will you talk a bit about the gap that exists with healthcare in normal times for people seeking asylum in Israel? There are tens of thousands still of people seeking asylum, largely from Sudan and Eritrea. They don't have access to healthcare. So what is it to government kind of health insurance in the same way that an Israeli citizen or permanent resident would? So will you talk about particularly the clinic that you have in South Tel Aviv in Yafo, and how that caters to that community and the kinds of needs that you're addressing?
So first we took some measures. The first one, it was a decision to keep the clinic open. We learned that there is another clinic running by the Ministry of Health in the Central Station for refugees and asylum seekers, and they said that their consultations part will not work. So we decided to keep our clinic open based on the fact that there will be no other place they can go to. Secondly, we contacted the Ministry of Health very quickly, like in the end of February already, to start and speak with them. Okay, how do you go to be able and transfer information to the community, and also make sure that when someone has a corona, it needs to, they need to do tests. They don't have any health insurance in the regular health companies like us, health funds like us, and make sure that when they come to hospital, there will be no charge. So, and this is something that I must say, it's something that in emergency time, sometimes you can use opportunities. And I think the fact that the Ministry of Health suddenly understand, okay, we need physicians for human rights. We need them to be able and speak with the community. And we need them because they're the one who knows how many people, how they live, and it was very useful for the Ministry of Health to get the information we have. And we also understand that, okay, it's not a normal time. We are here not only just to criticize the government or criticize the Ministry of Health. We need to work a little bit differently and help them, really work together. And on the issue of asylum seekers and refugees, I think it works quite well. So together with the Ministry of Health, we translated all the information they published to Tigrinya. We also created a group of dialogue between some leaders from the community with the Ministry of Health, because you must understand that on regular time, some people come to the hospital and the hospital don't allow them to come even inside because they have former, let's say, death to the hospital. So they don't allow them to come in. So there is a lot of suspicious goes around between the Israeli in general authorities and people like asylum seekers, refugees. So I think the fact that we kind of enter in the middle, made this mitigation, I think it helped. And after a few weeks, also we pushed the Ichilov hospitals and the Magen David Adom to open a testing place in the old bus stations.
Oh, wow.
Yes, and they open, and actually there are no so many, like very few got COVID-19 positive.
Well, I feel like that was one of the fears for that community, because the community tends to live in, in small apartments with maybe multiple people and multiple families per apartment. Maybe there'd even be an additional social welfare gap because so many refugees and people seeking asylum, particularly in Tel Aviv, work in hospitality. And if they're working in cafes and restaurants and hotels and all of them are closed and they don't have income anymore, that's obviously an additional crunch on the community who don't have access to the normal social welfare system that Israelis do. So does this mean that they've actually largely avoided that was kind of my fear, is that there would be breakouts in this community because they were being undercared for, but it sounds like that hasn't been the case, which is good.
I think, we don't know exactly why it was not a big breakout, but everything you said is true. And one of the problems we had is that 90%, according to what we know, almost 90% of the asylum seekers were fired from the work. Mm. And those who used to work used at least to have this private health insurance. But now when they were fired, they don't have it. So one of the things we did, we started to get more and more calls to renew this insurance. So we have now a special budget just for this purpose, to renew for 3 months the private health insurance. It's better than nothing. It's not the solution we want, but the fact that some people still have this private insurance, they can, if they ill, they can still use it. And
from whom is the budget? When you say you have a special budget for 3 months, that's from philanthropy, or that's from the health ministry?
Philanthropy. No, philanthropy. Right. Philanthropy. And another things that we succeed to organize, we map all the asylum seekers we have who need dialysis. One of the problems is that the public transportation was shut down. So people who need dialysis need to go to the hospital 3 times a week. So we organized together with the Baderech L'Achlama, Road for Recovery, Road to Recovery, if you know them. So together with their volunteers, we organized, for 15, I think, dialysis patients, this transportations, and some of it also, when there was no volunteer, we had to, order taxi for people. So there are many, many small details, for every patient that you need to take care of. And we were very happy for the fact that, there was no a big breakout, and probably it's also because of the measures the state took. We have a lot of criticism about many things that the state is doing, but I think the COVID-19, some of it, you can argue if it was necessary or not, but you cannot argue that, okay, it's under control.
Right.
You can argue.
Just again, for a little bit of context, it's worth, we've been talking to our supporters and donors about this for the last 6-7 weeks since the COVID-19 crisis really began, that NIF Australia has now distributed more than $50,000 in emergency grants, almost entirely to organizations catering for refugees and people seeking asylum in Israel, to address the kinds of of issues that Run's talking about, including money that went to Physicians for Human Rights to deal with medical issues. We also gave a grant to an organization called ASAF to deal with humanitarian aid, to make sure that, again, refugees and people seeking asylum who have lost their jobs can still have access to food, basic kind of necessity toiletries, and also to the Hotline for Refugees and Migrants, which is an organization that our supporters and donors in Australia will have had a lot of exposure to help with legal issues, again, the renewing of visas that has to happen on a periodic basis to try and get people out of immigration detention, which is obviously not an ideal place to be at the moment. So this kind of emergency work, I'm glad that we were able to support. Just for a little bit of context on the kind of normal level as well, Run, can you talk about how many, what's the scope of the Yafor clinic in a normal time? How many patients will you see on a weekly or monthly basis? And how have you has that number gone up or down in the last 6-7 weeks?
Yes, so usually we have around 300 patients weekly, let's say. Some of them are return, so they come back every few days. It's more chronic. We see in general, we can say that in the last years, we see less patients, newcomers, of course, because there are less newcomers, but we see more the chronic issues. Problems, chronic issues. So, and the fact that, when we had amazing success and amazing news with the fact that the deposit law was canceled, but we really saw how people deteriorated more and more to poverty and don't have money for medications, don't have money for proper food. So those problems we saw really in the clinic. So around 300, let's say, on a weekly basis. During the COVID-19, what we did is we opened the clinic, but we try more to call people to come, and it was less walk-in. It was more patients that we invited, and those who need prescriptions for a long time, we provided them in the beginning of the crisis for a long time prescription. So we did some special preparation before it started, because we understood that it goes to be, closure and people would not be able to come. And another thing that we did, and it's this, it's not only the treatment, it's also what we call the advocacy. But advocacy can be, someone needs a treatment in the hospital and he's out of the hospital and they don't let him in. So to contact the hospital, to contact, the Ministry of Health, and to find solutions. It's something that some of the people, they're not coming to the clinic, but we still give them a lot of services because we find solutions by,
case management, like you have to kind of manage them even if it's not a kind of face-to-face contact.
Yes, exactly. And with that, we have hundreds a week.
So let's talk about one of the other big issues which you already highlighted a little bit, which was around the occupation. And let's start maybe with Gaza in particular. Am I right that Physicians for Human Rights is the only Israeli organization that is allowed to enter Gaza and provide humanitarian aid?
Yes, till the COVID-19, yes.
Sure. Yes. So what does that play out on a normal basis? What does that look like? Who are the volunteers that are going in? What services? What advice is being provided?
So we are allowed to go to Gaza with doctors, and the last, let's say, 2 delegations, we have between 15 to 20 doctors who enter, all of them Palestinian citizens of Israel. So with them go one person is our director of the mobile clinic. So he's the only not doctor who goes with them, but he's the one who have all the networks, amazing network we have inside Gaza to be able to walk there. So we get, in advance, we know 3-4 weeks in advance that we are going. We get a list of needs from the Gaza Ministry of Health. And it can be which kind of operations they need to do for people who cannot leave Gaza, the list of medications and things like that. And then we start to call the volunteers and see, and all the volunteers are people who works in the Israeli system, in hospitals, head of units, most of them very senior, and they go for between 24 to 48 hours. And they work very hard. They go sometimes to the operation room, and they don't go out for, all day because they do a very complicated surgeries inside. And other things we do, and this is something that we continue to do. Another 2 things, I say. One is deliver aid and medical equipment. For example, only 3 days ago, we sent a dialysis machine to Shifa Hospital in Gaza, a new one, cost $24,000. We sent protection equipment for the COVID-19. There was a very nice, I think, crowdfunding campaign running by some Israeli activists, and they succeed to collect 100,000 shekels. So we took it, and we only for Gaza. So all this amount went for, aid to Gaza, and we did it. We bought it and delivered. And it's, we have the connections in the hospitals, in the civil society, and the Ministry of Health there. And trainings, it's another things we do, training with the medical teams, because they cannot go, most of them cannot go out. When they can go out, we also organize things inside Israel. We had a very nice, I think, 4 days in Shiba Hospital last year, 2 times for nurses, one, and one for doctors. And now what we do, it's consultations by phones for some of the doctors. So because the personal relations are already created, so they do it, and we follow it. So on daily basis, they contact their counterparts in the Israeli side. And the fact that now we cannot enter, but the needs is enormous in Gaza, despite the fact that it looks like they succeed to control the situation in Gaza. There are only 17 cases, as far as we know, and some hundreds in isolation, but only 17. The question is if they have enough testing kits. Obviously, they don't. We just on Thursday there was a decision of the Supreme Court after we appealed to talk about the Israeli responsibility for the situation in Gaza and the West Bank. And we asked, okay, please be transparent with the aid you sent. So because of the appeal, Israel published more information about what they sent. It's very limited. But also the state said that there is a lot of aid they give, but they don't want to publish it because they fear for the Israeli foreign relations, which is
what does that mean? What do you think they're worried about?
So it means that they don't want to tell, and I think it's not the, sorry for the noise, man.
That's right. I think everyone understands these days.
Sorry for that. But so many times in the Supreme Court petitions, the state don't want to tell the public really what's going on, but they say, okay, we agree to share with the judges, one-sided, so the other side will not be in the court. We tell the judges what we do, and then they can take the decision. And this time the court accepted it, and actually didn't even need to accept it. They were very tough, let's say, 2 of the 3 were very tough judges. So they accept the state position. They don't think it should be publicly. The information they already published, they published. The rest, they say, okay, we understand it. Maybe there is a problem. We don't think it's a problem of foreign relations. We think it's more interior issue, because I don't think, you have in Israel the issue of the soldiers and Avera Mengistu, these topics that the Israelis are not very happy with any aid that goes to Gaza, and they don't want this political pressure, especially now. So in Gaza, the situation, it looks like under control, but anyway, they're under crisis. It's continuous crisis. They don't have enough, they have lack of medications, lack of equipment, also in knowledge, because the medical team didn't get proper, let's say, training for many, many years. In the West Bank, they took also very, very strict measures. They are still under emergency situation in the West Bank. They just announced it will be continue until the 5th of June.
Wow.
And but the Prime Minister said that maybe if there will be no new outbreak, they will cut it.
And what does that mean, emergency situation? Maybe give us an idea of what kind of the lockdown looks like in the West Bank, and obviously already in normal times limits on freedom of movement for Palestinians. So what does that look like particularly now?
So first of all, there are many more checkpoints, Palestinian checkpoints.
Right.
Second, now it's Ramadan time. So from 7 p.m., everything is closed. There is a curfew, actually. One second. I will ask my son to. Sorry for that.
That's okay.
So there is a curfew from 7 p.m. in all Palestinian areas. There are more checkpoints. If I, for example, wants to go to the West Bank, and it's less about me, but many of the Palestinian citizens of Israel on daily basis goes to the West Bank. Now they cannot.
Right.
They can't go to the West Bank. We got a special approval or special permit from the Palestinian side as well to come,
Sure.
which usually we don't need. So
Right.
that's how it looks like. And I think people are start to be, in Israel, it was very, very, I think, difficult to keep the closure for such a long time. And people didn't really obey it. So that's why now I think you see now in Israel, everything almost went back to normal.
I had the privilege of attending one of the mobile clinics in the West Bank a couple of years ago that's run by Physicians for Human Rights. It's an incredible site. There are, maybe 20 or 30 volunteers who come in. They take over kind of a community building in a village which wouldn't have normal access to medical care or more regular access to medical care. They set up a different consultant, a different specialist, a different, a nurse or an occupational therapist or a doctor in each room. And they just have a kind of a cycle of people coming through, asking questions and receiving both a kind of urgent and chronic care from doctors and nurses. It's a really incredible site. Obviously, that can't happen right now. Like you said, it's shifted to a pharmacy-only clinic. What's then the gap in medical care that usually Palestinians would need to cope with chronic issues, like you said, with dialysis treatments maybe in particular? What's the gap now that's not being filled, and is there going to be a medium or long-term implication to it?
So there is a big difference between the West Bank and Gaza.
Yeah.
We need to take into consideration that in the West Bank, they go, when they need a lot of the treatments, they go to East Jerusalem. So they are allowed to get, it's more advanced, let's say, hospitals, but still there is a gap and they need to send several cases to Israel. There are some, some specific, let's say, treatment that don't really exist, or more surgeries that not exist in the West Bank, and they need specialists from Israel. So, for example, it's quite rare, but we also from time to time send doctors from Israel to do surgeries in the West Bank. But in Gaza, it's totally different. In Gaza, first of all, in the West Bank now also to go to East Jerusalem, it's a problem. East Jerusalem is also a place where we don't have the exact numbers about the outbreak. Nobody really published it so far.
Right.
We estimate around 170 cases, which is part of the 530 in general in the West Bank. There was a cut in the budget of the East Jerusalem hospitals because the US reduced the support. So there is a problem there. They cannot pay salaries to the doctors. So just last week, there was a new, I think I saw some new donation they should receive from the EU and from EU countries, some more support, and also from Arab countries. But the PA took a decision, it was more than a year ago, that they don't want to cover any more treatment of Palestinian in Israeli hospitals. It means that it's very hard to get treatment for Palestinian in Israeli hospitals, because when they transfer, it's something that the PA pay for it.
Right.
Okay. So every day we had one or two cases that we approach the PA and convince them to cover the treatment for Palestinian person to get treatment inside Israel. However, in Gaza, the gap is even bigger, because in Gaza, many patients, like 1,000 patients, used to go out for a cancer treatment in Jerusalem or in Israel, and now they don't go out. They don't go out not because they don't get permit. The ones who want to go out will get permit. Like 300, I think, got so far, like all this period, 300 went out when usually it's a few thousand who are getting out from Gaza. And our fear is that in Gaza, they don't have enough material for chemotherapy.
Right.
Another thing they don't have is radiology. Radiology, you don't have it at all in Gaza. Okay, so this is something that people don't receive.
Radiotherapy, sorry, you mean?
Radiotherapy, sorry. Right. Yeah, no, chemotherapy they do have,
right,
but they don't have enough enough materials. But radiotherapy they don't get. They don't have at all.
How, just to kind of go back, you're saying that the Palestinian Authority have now said they're going to stop altogether paying for treatments in Israeli hospitals. That's a political decision, is it, in the context of kind of wider issues that are occurring, or did that come out of the blue for you?
It happened, like, as I said, more than a year ago, last March.
Right.
It was a political decision, also economical decision. It was a political decision because Israel reduced the taxes. Israel collect the taxes and transfer it to the Palestinian side, and reduce taxes that were supposed to go to prisoners. And so in response, the Palestinians said, okay, we don't want to send any more patients to your hospitals because we pay for it. And by the way, one of the hospitals, at least Hadassah Hospital in Jerusalem, it's really affected their income. It was a few hundred of million shekels a year. There's a very serious effect on their income. They try to solve it right now, but it was also a decision to, let's say, build better the Palestinian health system. They want to do capacity building and better capacity building of the Palestinian health system. Our criticism was, okay, it's justified to build the Palestinian system much better, and you deserve to have a much better, and we help in that, but you cannot just one day decide and cut it. You need a plan. You need to do it much more, in a program that you presented and you take all the measures so people will not stay without treatment. That was our criticism. We met the Palestinian Prime Minister, and unfortunately we didn't succeed to change his mind, but he was very open and invited us to come and do, more training in Palestinian hospitals and more cooperation.
I mean, it shows, I think, to me, or let me say as well, if anyone has any questions, feel free to click the Q&A box at the bottom of your screen and type them away. I want to ask a question more about kind of occupation, given that it's now 50 plus years. The stories you're telling me reinforce the kind of interdependence that Palestinians have on Israel for treatment, but also it seems that the Israeli health system, like you said, Hadassah Hospital, has on Palestinians. Is it possible to have any kind of improved health system or health outcomes for Palestinians in the West Bank without an ending to the occupation? Like, how crucial is that kind of milestone of ending the occupation, moving towards some kind of permanent arrangement? How important is that item, or can this continue in the long term, actually, and it's kind of somewhat sustainable?
Hey, hard question. Thank you for that. I don't think you can really have an independent health system, Palestinian, with the occupation. You have Israel control all the medication that goes in and out. Israel control where the Palestinian can buy equipment and medications. Israel control what goes to Gaza and what don't go to Gaza. Israel even control, all the East Jerusalemites hospitals are under the Israeli Ministry of Health, although they don't really budget them. And now there is, by the way, and what we see during COVID-19, from more positive, let's say, side, we see more cooperation with Gaza, with the West Bank, and also with the hospitals in Israel. You even saw I think the public statements of the Jerusalem mayor about the situation of the hospitals in East Jerusalem. So I think in the end, if Israel really want to run a proper, let's say, occupation, they won't be able to run the hospitals because it costs a lot of money to run it. And we think, everyone deserves the same rights, the same health access. So in the end, I don't think Israel will be able to continue run the occupation and provide the equal treatment to everyone. But what we also think that if the occupation will end, still Israel will have, and the Palestinian will have to have cooperation with the Israeli part. First of all, in the health system in Israel, you see Palestinian citizens of Israel, you see Jewish citizens of Israel working together, and the Palestinian citizen of Israel works a lot in cooperation with the Palestinian ones and also the Jewish. So I think the health, it's a very good example of how it can be in the future. There are many problems, nothing is equal yet, and we know also about the tension inside the hospitals sometimes between Jewish and Arab, but in general, it's amazing to see this cooperation. What we do see in this period that Israel also, there are no borders. Like one of the issues we were involved in together with PHRI and Kavla is the Palestinian workers. So Palestinians workers been in Israel, went back to the West Bank. Many of them were positive with COVID-19, and they are the one who part of them brought the virus back to the West Bank. Like I think 30% of the cases in the West Bank, it's Palestinian workers who've been in Israel.
Right.
So see, there are no borders, and as you said before very correctly, the virus doesn't know if I'm Jewish or Arab, Palestinian, or Israeli, and they must cooperate, and health is a good example to do that.
Well, there's a great question about annexation from Russell in the Q&A, and I want to get to that. But just before, there have been a number of, like you said, Palestinian workers who would usually come through checkpoints every day, mostly I think working in construction, who would work in construction and then go back. There's been a deal, though, between Israel and the Palestinian Authority to allow a number of them, I think quite a large number actually, to stay inside Israel, work for a period, and then be able to return, where both sides kind of realized that, like you said, they're possible vectors of disease transmission, both the Palestinian laborers going back into the West Bank and bringing coronavirus with them, and on the flip side, coming from the West Bank and bringing the disease into Israel. What does that tell us, that story, that now instead of going every day through the checkpoint, ostensibly for security reasons, now there's a kind of greater purpose and a more important maybe value that's being placed, and that's continuity of employment, continuity of the economy, and allowing Palestinians to stay inside Israel. So what does that tell us maybe about the broader system?
First of all, I think it shows that the security issue is not always, I believe there is a security issue, but not in the sense of the government is playing with it. It's much probably less than the way they use it. However, by the way, in this specific issue, I'm also happy to say that we succeed to push the government, and now all the Palestinian workers should have health insurance, because so far they used to come to one day or go back, and if they ill, they go back to their clinic in the village in the West Bank. But now they're stay here for 2 months, and it's, as you said, it's between 30 to 40,000 workers. So
wow.
Those people now deserve, because together with PHRI and Kavla Oved, we did a petition to the High Court, and the government took a decision that all the employees needs to do insurance for their workers.
Right,
so
the employers are now paying that insurance. Right.
Exactly, yeah. And also they need to provide proper places to sleep and food and everything. We need to see if it will be implemented, but according to, there is a government decision, it's a law. So they have to do that. And this is exactly how the civil society works during emergency time, to see those, the places or the blind spots where the government doesn't see. We intervene and we kind of help them to see that. And some of the time they do the right thing.
Not to be too cynical, but I'm sure that every High Court decision is always upheld by the government and always followed to the letter of the law in the timeliest circumstance possible. I'm sure in this case it will be as well, at least certainly I hope it will be. Mm-hmm. Russell's question, the Q&A about annexation, is how likely do you think, which is beyond the remit of our discussion about healthcare, but how likely is it, do you think, that Gantz and Netanyahu will go through with some form of annexation? And certainly what will be the impact on healthcare for Palestinians, particularly if they end up, the Palestinians in the Jordan Valley, who end up having sovereignty, having annexation applied over them, but may not themselves become citizens. What will happen with their healthcare, and how is Physicians for Human Rights kind of preempting and beginning to think about that situation?
Okay, so first I will give a statement. I don't think there will be official annexation. I don't think Israel needs it because on ground there is an annexation already. On ground, there are more and more laws which comes from the civil law and not from the
military law.
Army law, military law. So I don't think really on ground they need it because it just will create more problems, foreign affairs with the Americans, maybe even, not only with the Europeans. So I don't see the reason why they really need the official annexation. Even the settlers, I don't see why they need it, okay? But this is my, analysis. I don't think it will happen. Secondly, on ground, as I said, there is already annexation and we see the gaps. The problem is, let's say a problem, but there is an Oslo agreement and the Palestinians took upon themselves the health part. So despite the fact that we think that, okay, Oslo agreement are not really applicable anymore because Israel didn't really follow their side. They did what they have to do according to the agreement. So they need to take the responsibility for the health. From the Palestinian side, they will not give up the responsibility on the health. Right. So we are considering right now what we should say, not on the annexation, but in general about the situation when a settler need treatment and the Palestinian need a treatment and they really live the same place with just, let's say, a fence between them, and the settler can go to Sheba, but the Palestinian cannot go even sometimes to Nablus, to the hospital. Right. It's a real problem, and we're have a board discussions now, really nowadays, what we should demand, taking into consideration that maybe actually the Palestinian side will not be very happy with our position. As for the annexation, obviously it's illegal, it's immoral, and it's something that, won't promote any human rights. And we fear also from, the violent response as well. So all those things hopefully will not happen.
Okay, there's kind of a mechanical question that Ray has in the Q&A, and I think if we do that, we'll show a great video that you've produced about some of your emergency work. Ray's question is the medical volunteers that go into the West Bank, it seems. I think that's what Ray's question is about, are mostly Palestinian citizens of Israel rather than Jewish citizens of Israel. Can you give us a sense about some of the demographics around that? I know I have a friend who's originally from Melbourne who's a physiotherapist who volunteers with Physicians for Human Rights a lot. So, but yeah, if you can give us a sense of that breakdown.
Okay, so on Saturdays, the ones who go to the West Bank is, let's say, 70% are Jewish, 30% are Arabs, Palestinians. Not all of them, of course, doctors. It can be nurses, it can be physiotherapists, it can be translators. The one who goes to Gaza are only Palestinian citizens of Israel because Jewish cannot go to Gaza.
And I assume that's an Israeli regulation that
kind of
says we won't let, which from a kind of security and safety perspective, I think that's right. We're gonna, I think, wrap up here. I'm gonna show this quick video that Physicians for Human Rights.
Yeah, maybe I will give a short. Yeah, I'll give an introduction. Maybe so. The COVID-19 actually exposed something that we talk about many years about the problem in the health system in Israel. It's under budget for 20 years, at least since the public health insurance law, let's say, passed. Since then, it's in deterioration, and it's amazing law. But we see how every government gives less and less money to the health issues, and we see it in Israel for Israelis, asylum seekers, but also the aid Israel gives to the Palestinians. And so we initiate a crowdfunding campaign nowadays to take care that no one will left behind. And this is the video Liam is going to show you in a second. Now, exactly.
Now, yep, now it'll do, yep.
Yeah, this crowdfunding campaign. Okay,
we'll go.
Let's see.
זה לא נגמר.
זה לא נגמר.
זה לא נגמר.
זה לא נגמר.
זה לא נגמר, כי עכשיו זה הזמן להיאבק בהשפעות של משבר הקורונה.
ובמדיניות שפוגעת במוחלשים ביותר.
כי עכשיו ברור שחייבים מערכת בריאות ציבורית חזקה,
ושוויונית.
שלכל אדם,
ישראלי,
פלסטיני,
מבקשת מקלט,
יהודים וערבים,
תהיה נגישות לטיפול רפואי הולם.
כי זו הבריאות של כולנו.
תמכו בנו וביחד ניאבק כדי שאף אחד לא יישאר מאחור.
Wonderful.
Yeah.
A lot of people, I don't know if you want to kind of add more, but a lot of people will remember, or at least be able to see some friendly faces in that video. One is Mushira, who was here just a couple of years ago, not for NIF, but is obviously a very important part still of Physicians for Human Rights, as is Rafi Valden, who was also here he came out, I think, for the Union of Progressive Judaism. And he's obviously still very closely involved in Physicians for Human Rights. So it shows it's some wonderful cross-pollination between Australian Jewish organizations, between Physicians for Human Rights and the work that you're doing. So with
Rafi
that,
is our president,
right.
and Shira is our chairperson, and the rest of the people volunteers who work on Corona in the hospitals. And actually the campaign talked about the impact of Corona for those, it's not over. For me, maybe I feel it's a bit over because my kids went back to kindergarten school, but for many people, it's just the beginning actually of the economical crisis, and we should be there for them.
So we'll say thank you to everyone who asked a question. Thank you to everyone who's joined us on Facebook and on Zoom. A really big thank you to Ran for joining us during what sounds like an incredibly busy period for Physicians for Human Rights. Like I said, we are really privileged to be able to empower you and the organization to do the incredible work that you're doing for refugees and people seeking asylum. In particular, right now, during the COVID crisis, like I said, we've committed more than $50,000 in the last 6 weeks to that particular work, including to physicians. And of course, the ongoing work that we continue to support as well around, like we've been talking about, Palestinians in the West Bank and Gaza, prisoners and others. So a really big thank you to Ran, a big thank you to everyone for joining us. I hope you all stay safe. And have a good evening, and we'll be in touch very soon with some more wonderful NIF events. So thank you again.
Thank you. Thank you, everyone. Bye-bye.